Good afternoon, and thank you all for being with us today. I also want to take this opportunity to especially thank the great people of the state of Mississippi, particularly for your safety efforts. You are making a difference. The numbers are falling, and they are falling quickly because of your hard work. Keep doing what you're doing because it's working. People in this state and across this country and across the globe have been hit hard by this virus and by the economic fallout that it has caused. We've proven that we can fight this thing without shutting down schools or without closing private businesses. Freedom with targeted intervention works. It is a tremendous ongoing achievement by the people of our great state. But make no mistake, it is still ongoing. We are still in the fight. Please stay sharp. We also know that our people have been hit hard economically here at home. People are out of jobs, and that is a terrible, terrible problem. In every problem, though, there is opportunity. As people return to the workforce, we can help them find better, higher paying jobs. That is my priority, increasing access to good pay for an honest day's work. I'm pleased to give you a status update on a program that we announced just 5 short weeks ago called Reskill Mississippi. I have Patrick Sullivan here today, who is the chairman of the Workforce Investment Board, to help us with an update and answer questions that you may have. Reskill Mississippi is an initiative to help fight the COVID-19 pandemic on the economic front, specifically designed to help individuals and employers across Mississippi who have been impacted. It is designed to help Mississippians get training for a better career, either through one of our state's community colleges or through on-the-job training with an employer. I told you on August the 5th that I believed Reskill Mississippi may be able to help some of those who are hurting. I'm here today to let you know that in the short time since that announcement, this program has effectively done just that for over 2,000 of our fellow Mississippians. This program, which was initially recommended by my Commission on Economic Recovery, was made possible through the Mississippi Legislature and was created through a collaborative effort on the part of the State Workforce Investment Board, the Mississippi Department of Employment Security, our state's 4 local workforce areas, and Mississippi's 15 community colleges. Reskill Mississippi has 2 components. One that allows individuals to get short-term training at one of Mississippi's community colleges for skills that are in high demand, and another that incentivizes companies to train individuals on the job by reimbursing wages during the training period. As of Friday, September the 4th, over 1,700 individuals were enrolled and getting short-term training at 12 different community colleges, and another 340 individuals have been hired and are getting trained on the job by Mississippi employers. Now, I want to be clear. We are not here today to spike the football. While this program has impacted 1,200, over 2,000 of our fellow Mississippians to date, the work of Reskill Mississippi is far from over. In fact, we hope that this is simply the beginning. I want everyone to know that there is more capacity for both individuals interested in Reskill Mississippi and for employers out there who are interested. If you think this program can help you get back to work, or if you are an employer looking to expand and grow, please go to reskillms.com and sign up for this opportunity. It is not too late to sign up, but it may be too late if you wait later in the fall. The CARES Act mandates that this money be spent before the end of this calendar year. When I campaigned for governor, I talked a great deal about workforce training and how, with the right strategies, we could raise average household incomes in our state. I'm encouraged, in fact, I'm incredibly encouraged by the first month of Reskill Mississippi, and I am hopeful that it can be a model for the types of programs that we can employ for the duration of my time in the governor's mansion. I'll conclude simply by reiterating that if you are an individual who is hurting economically because of COVID-19, this program may be for you. If you are an employer looking to hire individuals and train them yourself, this program may be for you. Please visit reskillms.com and fill out the appropriate form. This is a tremendous opportunity, and I want all of you to take advantage of it. At this time, I'm going to pass it off to Patrick so that he can give us a further update on Reskill Mississippi. Patrick, thank you for being here, and thank you for what you and your team are accomplishing.
Thank you, Governor. At this point, everyone has been impacted one way or another by COVID, with many people out there being very directly impacted through job loss. I thought one thing that may be of interest is a high-level view of what the employment situation looks like in Mississippi compared to the national average. Mississippi has fared a good bit better than what the nation has fared overall in terms of job loss. And so Mississippi at its peak back during the quarantine was down 10.5%, where the U.S. overall was down 14.5%. Since then, almost 2/3 of those jobs have returned back here in Mississippi, while the nation is still lagging. Only about half of the jobs lost overall in the country have returned since the bottom. And so, overall, some good things are happening in Mississippi, and we're outperforming the national average. But saying that, to the governor's point, and for the purpose of Reskill, is to help connect more people with opportunities. And we know that not all of our jobs have returned, but we also know that there are opportunities out there even today that are unfilled. And that's what we're trying to do. We're trying to encourage people to consider what those opportunities are and connect through Reskill, so somebody can reach out to them and explain to them whether it's a training opportunity that's going to get them prepared and qualified to get into a higher wage occupation, or whether it's an opportunity that an employer may need to go straight to work. We want employers out there to hear that there are still opportunities left in these programs. If you're a company and you're an employer, whether you're small or large, and we've had 71 employers to date across the state sign up and participate in the program, whether it's for one position or 20 positions. There's still room. We want you to consider that. If it's an occupation that pays an attractive wage and requires on-the-job training, please go to reskillms.com and sign up. Just a few more numbers. Since we announced this just a little over a month ago, some 4,300 people across the state has signed up. As the governor said, just over 2,000 of those, as of late last week, have benefited either by enrolling in a training program or going straight to work in on-the-job training. And again, 71 employers participating across the state. But to emphasize what the governor said, we want to share the results as we move along, but this is something that we feel like is going to be a persistent effort. We want to help people in 2020 through all the challenges, but we want this to go beyond 2020. The goal of this, again, is to connect people with better opportunities. So please go, whether you're an employer or whether you're an individual or you have somebody in your family that you feel like may be interested in a good candidate, go to reskillms.com.
Thank you, Patrick. That's Reskill, RESKILLMS.com. That is for you if you are either an individual looking to get trained up for a job where you can increase and improve your wages, or if you are an employer looking to do on-the-job training. We have resources available that can help you there. I want to again commend the Mississippi legislature. We worked very closely with them to ensure that this program was funded. Obviously, we worked closely with them on a number of programs, all of which are important. But when you think about long-term economic growth, with or without COVID, it's this training and retraining of the workforce and investing in Mississippi's people that is going to make a difference. And so we're very proud of this program. We appreciate the collaboration with the legislature, with Patrick and his team, and we're going to continue to build on this in the future. At this time, I'm going to turn it over to Dr. Dobbs, who is going to give us an update on our numbers. Dr. Dobbs?
Thank you very much, Governor. So today we're reporting 517 new cases of coronavirus, and along, sadly, with 33 additional deaths. Overall, we've seen considerable progress over the past several weeks, and would like to very much encourage everyone to continue with social distancing, small groups, and masks. We can see that our efforts have really been fruitful, even in the context of outbreaks in college towns, transmission around K-12, which has really gone much better than we might have anticipated. When we look at the school situation, we can see from the previous week, we have 124 new students, 124 new teachers, I apologize, 326 new cases reported among students, and 16 new outbreaks. If we look at the total number of teachers on quarantine, we have 458 and 4,057 students on quarantine, which is going to be a pretty small percentage of the total population. The schools have done a fantastic job of responding and making sure that they're identifying cases and quarantining because they want to stay in school, and we certainly want to support that effort. I do want to reiterate the importance of the quarantine process. I know it's disruptive to individual students to have to be out of school for a while, but that's that next layer around the contagious case. That keeps us not only from having additional cases spreading beyond that shell, it keeps the schools open. It's an unfortunate but effective mechanism to make sure that we don't have ongoing transmission within the schools. And the less cases we have, the fewer quarantines we're going to have. And keep in mind, if we can keep students 6 feet apart throughout the day wearing a mask, they will never have to quarantine. So I would encourage us to continue to be creative in making sure that we keep our students properly distanced and wearing a mask so that we can avoid those cases and also quarantine necessities. And then the last thing I'd like to touch on is testing. We are continuing to test, and we have testing in counties throughout the state. And starting on Monday, it'll be within every single county every week. Free testing available, and it's available to people who have symptoms or exposure or concern of exposure. We're not going to validate that, but if you think you might have been exposed and want to get tested, please get an appointment, come and get tested. But also, teachers and staff in K-12 can get tested just if they want to. There's a special line item on the appointment where you can get an appointment if you're a teacher or work in K-12. And we added this week daycare and preschool employees. So if you're in any of these groups, even if you don't have symptoms or have been exposed, please come in and get tested for free if you are interested in doing so. Governor, that's all I have. Thank you.
Thank you, Dr. Dobbs. Appreciate your hard work. At this time, I'll turn it over to Director Michelle, who is going to give us an update from an emergency management perspective.
Thank you, Governor. Good afternoon, everyone. Just a quick update on the Mississippi COVID Emergency Relief Fund. You've heard me talk about this every day. I'm going to continue to do that until the application period ends on October the 15th. Thus far, we received 120 approved applications. Those are applications from either counties or municipalities that meet the eligibility for the Mississippi COVID Emergency Relief Fund. Of those, we have already approved 11 projects that have been submitted from those applicants, and then there were 9 additional projects that were submitted just yesterday. Those projects total right now just almost $5 million. So as you can tell, we're a long way to go with regard to utilizing that full pot of $70 million. So the point that I want to make, 2 things. Reminder, this is not a grant program. This is a reimbursement program. So the next step from your application is to make sure that you submit your work projects for reimbursement. You are going to be allocated a set amount of money based on the population of either the county or the municipality. And then from that, then your work application will be approved. A reminder that the application end date is going to be October the 15th. There will be no extensions from October the 15th for that program. So you need to act now and act quickly. I would just say that one thing that we are telling counties and municipalities is based off of U.S. Treasury guidance that backs up the CARES Act guidance for utilization of this. Public health and public safety payroll from the period beginning 1 March through the period of this application period is eligible for reimbursement under this program. So just a little hint and a little tidbit, that is reimbursement, and that is one good way to submit for reimbursement on this program. Just a reminder about a quick update on hurricane season. We are currently now watching 5 systems out in either in the Gulf or in the Atlantic. I'd like to talk real quickly about the 2 systems that are in the Gulf. Prior to this press conference, I was hoping to come in and tell you that both of these systems had a low chance of development. One of those still does, that is already in the Gulf. We do have one, though, that is just off the Bahamas heading westward towards Florida, that is supposed to cross the peninsula, get into the Gulf later this weekend. It is now a medium chance of development. So I say this to just say that we need to be very vigilant and watch this. Even though the first system has a low chance of development, both of these systems being in the Gulf of Mexico this time of year is something to be concerned about, and something certainly worthy of watching throughout the weekend, and we will keep you posted on a daily basis. The other 2 systems, Tropical Storm Paulette and Renee, pose no threat to the mainland currently. We don't expect anything there. We are watching a tropical wave coming off of the coast of Africa that has a 90% chance of development. Long term, that's going to be one to watch. And just a couple of factoids, we are now officially, today is the peak of hurricane season. There's already been 17 named storms. And if I remind to you what we talked about, there were supposed to be 18 to 21 for this entire season. Halfway through, we're 17. So again, on our way to set a new record there, Governor. That's all I've got today, sir.
Thank you, Greg. I appreciate that. We're going to have both Greg and Patrick available for questions. They'll flip in and out as necessary. At this time, I'll open it to questions. Cordia?
Governor, we're about 4 days away now, I believe, from the safe return order set to expire. We find ourselves in a little different position than we have at the time that some of these others have been set to expire, with numbers improving. Can you walk us through the process of kind of the decision-making and conversation that you and Dr. Dobbs are having about how long these orders need to stay in place, what it looks like, what are the thresholds, since it seems to be working?
Yeah. Well, thank you for the questions. Obviously, Dr. Dobbs and I are in constant contact and communicate regularly. Obviously, as we look at where we find ourselves today, our 7-day average of new cases over the last 2 days has fallen below 500 for the first time since June 24th. So almost 3 months, the daily 7-day average has been worse. And as we look back over the things that we have enacted and implemented, there is no question that the people of our state and their buy-in to really doing everything they can to slow the spread of this virus and reduce it has worked. And so as we look towards the current order expiring on Monday, sort of the thought process as we look towards that is obviously we've got to think about the notions of mask, the statewide mandate, as well as mask within our classrooms. And I think as we look at the scenario that we've seen over the last several weeks, again, I have said from the beginning, my reluctance to issue a statewide mask mandate was more because I believed that we could get more people to wear masks in those counties where we most needed them by being very specific, and that's what we did on 3 different occasions over a 6-week period. And as I look back on it, I really do believe that played a significant role as we built up to the necessity of going statewide. As I look at where we find ourselves today, I'm exceptionally pleased with the effort of the people of Mississippi. But I also think coming out of Labor Day weekend just a couple of days ago, that as we look towards next week, it is not likely that we will see a reduction in the need to wear masks statewide. I do think that as we look at some of the things that have transpired and the way in which people are operating and acting, that we will be able to loosen some restrictions out there, particularly in outdoor spaces. Maybe we had at one time we had the ability to do slightly, not much, but slightly larger crowds than the 10 and 20 if it were outdoors. I think that's something we'll look at going forward. And I think that that's a way in which to also look at private small businesses and realize that what we have found, and this is certainly true in K through 12 schools as well, but where there is structure, then we tend to do pretty well. It is when you get into those scenarios where there is not structure, say in bars at midnight, where, and this is not unique to Mississippi, it's true everywhere, where there is less structure, there is significantly more risk of the spread of the virus. And so we're at a very important inflection point now. We went up to a period of time where we had 1,381 daily cases over a 7-day period at our peak, and now we're down below 500, and I really would love to see us over the next several weeks continue to drive that number down so that when we get to October, perhaps we can be at a spot where we can open up even more things. And again, I think right now 90% of Mississippians are able to do 90% of what they would want to do in a normal year. And as Patrick mentioned earlier, I come from the world of investments where you got to look at things in two ways. One is in an absolute performance standpoint, but also on a relative basis. And from an absolute standpoint, 90% of the people doing 90% of what they want to do is not as good as any of us would like, because we'd like 100% of the people to be able to do 100% of what they want to do. But on a relative basis, if you look at how we're performing both in terms of the virus, the downward trend in the numbers, as well as how we're doing economically, and when you consider the fact that the states that exist out there in which there is virtually no kids in school, there are no kids in college, there's no youth sports, there's no actual high school sports, there's no in-class learning. Mississippi is faring well, and we just got to keep building on it. We got to be smart. We got to be tactical in the way in which we continue to give people freedom, because we want people to have freedom, while at the same time protecting the most vulnerable amongst us.
Real quick, you or Dr. Dobbs, do you all worry about
Yes.
the message that it sends to the public when and if that order does expire, to go from a statewide mandate to back to the personal responsibility side of things, where we saw what happened? Do you worry that when and if it does expire, that people will say, okay, well, things are better?
Well, first of all, I'd say I wouldn't expect it to expire on Monday. But the other thing I would say is, yes, I worry. Look, I worry about the fact that in these press briefings that we have had as many as 25 members of the press participate. Today we have approximately 10. That worries me, and because that to me is an indicator that this is not our first rodeo. Even in 2020, we have seen, and we saw in late June, as people became less focused on it. And I understand why people want to be less focused on it, because I want to be less focused on it. But we have also found that as people wear a mask in public, as they stay socially distanced, and by the way, I will just tell you my personal view, and this is not a medical view by any circumstance. I think as we look at what's really worked, I do think people wearing a mask worked, but I think people having a mask on makes them even more conscious and more aware of their surroundings, and they tend to get much less close to people. It's a natural habitat. It reminds you of where you are and why you have that mask on. And oh, by the way, maybe I shouldn't give you a hug today, right? We in Mississippi are huggers, and we are people who like to be friendly and be friends with people, and so it's just our culture. But I do think the masks wear that. But yes, we certainly think that individuals the recognition that the virus is still here, that we don't yet have a vaccine, although we're seeing positive developments there. We're not there yet, but all of that's helping us again get more and more back to normal as our numbers have continued to decline. Hospitalizations have declined considerably. Total hospitalizations today, if you look at both confirmed COVID patients and suspected COVID patients are below 670. It reached 1,250 at the peak. And so we're not quite halfway of where we were at the peak, but we're basically halfway where we were. That's very, very positive. That doesn't mean we shouldn't still pray for those nearly 670 people that are in the hospital with COVID, and that's a lot of people, by the way. But it is a lot less than where we were at our peak, which certainly frees up capacity. Yes, sir.
I have a question for Dr. Dobbs. Mississippi's overall new cases are going down, but we still see a lot of outbreaks in college towns, and Oxford has been ranked as one of the highest in the country as far as outbreaks in a single city. Can you talk more about that and your concerns over having that much outbreak in one space?
Yeah, well, certainly we're not exceptionally surprised, right? I mean, we knew that was going to be a real challenge. I would like to reiterate that I think that the measures taken on the campus are really exceptional and feel very comfortable when we visited the universities in Mississippi. It's the off-campus stuff. It's the parties. It's really just gonna be one of our biggest challenges. I think CDC and folks recommend that when people get sick that they stay there and don't go back home. I think until isolate, like maybe in like isolation dorm. But what we see is that folks are going, I mean, if it were my kid, I'd want to take care of them. I understand that. It's a real concern that it's going to seed into the community. I really hope now that people are settled in, we've gotten past some of the bid day and some of that other stuff that we've seen, if we can sort of get over the hump a little bit. I worry about going into football time. Not so much about the football stadiums themselves, but we need to think about when we have our own social gatherings. I would strongly encourage everyone, if you're going to have folks over, make sure it's not very many and do it outside. The weather's great right now, so let's just keep our guard up and realize that we're going to have vulnerabilities. We've been working closely with universities and also too with the mayors, and they are really doing everything they can. But it's just hard to overwhelm youthful spirit. But I really just plead with everybody just to show some patience and some restraint so that we don't undermine our good progress.
Frank Porter with Y'all Politics has a question.
Hey, Governor.
Hey, Frank.
Quick question. You're talking about the economy a lot today. And today, U.S. Senate candidate Mike Espy put out a commercial that was quite critical of Senator Hyde Smith's stance that the state should open up the economy as fast as possible. As the person who is essentially responsible for that in the state, do you take umbrage with the criticism from Mr. Espy, since basically it's a criticism of you?
Well, what I would say, Frank, is that, as I said the other day, it is the politicization of this particular virus is unfortunate. But what I would also say to you is this. I mean, candidate Espy is a liberal Democrat that is always going to criticize anyone who is trying to grow our state's economy. If Mike Espy is elected to the U.S. Senate, he is going to do exactly what Joe Biden and his liberal advisors tell him to do. Joe Biden has said that he would shut down the economy, and I believe that if Biden is elected president and Mike Espy is elected to the U.S. Senate, they're going to try to shut down the U.S. economy for months and months on end. And what we have proven in our state, time and again, is that if we will do the little things, if we will wear a mask in public, if we will stay socially distanced, if we will take care of ourselves and take care of our neighbors, and if we'll love ourselves and love our neighbors, that we can do economic activity, we can grow our economy while at the same time protecting against the virus. The numbers that Patrick talked about earlier, it's amazing to me that a liberal Democrat running for the U.S. Senate in Mississippi would look at Mississippi's response and say, when you look at the total increase in unemployment during March and April, and that Mississippi's unemployment numbers grew significantly less than the national average. And when you look at where we are today and compare us to so many other states, and you see that nearly 2/3 of the jobs that were lost in Mississippi have come back, while only half of the jobs that were lost across the country have come back, I don't think that Mike Espy wants to be having an argument on economics based upon the decisions that were made in pro-business, pro-employee states like Mississippi, and in those states that just shut down forever and ever and ever. Because the reality is that leadership has consequences, decisions have consequences, and the huge high unemployment rates in those states run by liberal Democrats speak for themselves today.
Hugh Keaton with Renew LOX has a question.
Yeah, a question for Governor Reeves, and I see that MDES is scheduled to start taking applications in for the extra $300 assistance of unemployment assistance. Do you see any problems with that money starting to go out soon, and what can those people, when can those people that need that assistance expect to receive the extra $300? Thank you.
Yeah, well, thank you, Hugh. I appreciate the question. I actually had a conversation yesterday with Jackie Turner, who runs the Mississippi Department of Employment Security. We made the decision weeks ago to participate in that program. And let me just point out, I want to thank President Trump again for his willingness at a time when the Democrats in Washington would only agree to an additional package if the Republicans said at least $2.5 trillion of your money was spent. President Trump stepped up and made this additional $300 available through the Stafford Act. And so were it not for him, this would not be occurring. As we talked about with employment security back in March when this initially hit, if you're going to significantly change the way in which you do benefits for literally thousands and thousands and thousands of people, it has to be done from a technology standpoint, and you have to change the coding. And so, having talked to Jackie yesterday, I anticipate that these additional $300 in weekly payments, which by the way are time limited, but I do anticipate that those could start being sent out as early next week.
Yeah, Governor, the president has recently admitted to purposely misleading the people about the threat of the virus back in February. Are you concerned about that type of misleading, trying to, he said, prevent a panic? And then for Dr. Dobbs, do you think that if the president had shown leadership and explained this in a more realistic sense and talked about the deaths early on, that we could have prevented some of the spread that we've seen?
What I would say, and then I'll let Dr. Dobbs answer, what I would say is this: we've been engaged and involved in conversations with the White House and the leadership of the task force from the beginning on this. And I certainly think that it is, I do think it is a worthy goal to try to ensure that we do not create a panic situation. If you'll recall back in March, the notion of people going out to the grocery store and buying up all the toilet paper, for instance, people going out and doing things because they were concerned, justifiably so, the concern was there, but we did not need to create a panic in our state or in our country. And so what we've tried to do is be honest with the people of Mississippi. I think the president's tried to be honest with the American people, while at the same time trying to avoid creating that panic, which then leads to people doing irrational things. The other thing I'll just point out, and this has been a real problem from the beginning, and that is there are a lot of folks that are that have been concerned about the virus, and rightly so. But then there have been those that no matter what happens, they say, well, this is good news, but let's just wait 2 more weeks. I'm glad that the numbers are coming down, and as you said earlier, I'm glad that the numbers are coming down in Mississippi today, but Oxford, this one small town and community, which is very important and a very beautiful place, happens to have the University of Mississippi there. They've added an additional approximately 20,000 new residents, if you will, because the kids are back on campus. And therefore their numbers on a per capita basis, which is really based upon the number of people in the town, that doesn't include that additional 20,000 people that are students. My point in all of this is saying the virus is real. The virus is deadly. The virus is something that I spend 90% of my time on every single day. But we also have to recognize that there are things that we can do to protect against it. And that's what we've tried to do. I think that's what the president and his team have tried to do to prevent panic, to keep the American people informed, but also to make sure that the panic doesn't occur, even worse things to happen than the actual virus itself. In other words, as it's been said repeatedly, and I've said it more often than I'd like to remember, we can't let the cure be worse than the disease. And so I think as we look back on the last 7 months, I know I can certainly say, look, there are decisions that I made that I wish I hadn't made, or there are decisions that I made that I wish I had had a little bit more information. And as I look back on our numbers, I certainly see a lot of things that maybe we would have done a little differently if we knew then what we know now. But unfortunately, in these once every 102-year events, you don't know exactly what's going to happen from day to day, so you just make the best decisions you can make given the information you have at that time. So with that,
in February and even March, there was so much we didn't know about the virus, and there was a lot of fear, actually. I mean, you look at sort of the reactions that we had. We also had some really bad outcomes, and certainly we've learned a lot, and we've come to a conclusion which seems to be borne out by fact that modest measures are effective. And so we've kind of settled in the middle zone of what we need to do to keep ourselves safe. As far as, some of the comments that were made, I will say even now there's a debate about the airborne versus droplet stuff. So we still actually have a good bit to learn as far as the transmission and the risk. But clearly, we see it's more deadly than flu. We know that. We've been saying that since the beginning. So we still have a lot to learn, I'd like to say. But I think we've learned the big lessons that we need to know. We know that spacing and masking is going to be extremely important going forward. We've got a lot to learn about any new vaccines that are going to be available, hopefully within the near future. But we got to go with what we know. Certainly, I think early on there might have been some miscues within the public health communications, throughout our country, where maybe we could have done a little bit better. But Dr. Fauci and other folks early on were saying stuff that were very cautious, and so there were good experts up there, kind of giving us good guidance, and we'll try to make sure that we continue to pay close attention to the scientific experts to give you guys the best advice.
Dr. Dobbs, yesterday I was speaking with one of the Jackson area hospitals, and they were talking about how they do have fewer cases, about half of what they had at the peak, but they also have fewer nurses because they lost so many to travel when other southern states had a surge around the same time that we did. How significant of an issue does that seem to be from what you're aware in hospitals around the state?
It's a huge issue. Hopefully, we'll start to get some of those nurses back in the event that we have, more cases. But the nursing workforce is kind of like our ICU resources are oftentimes pretty thin anyway, and so it doesn't take much to overwhelm the system. But it is a real challenge, so I encourage people to go into nursing. It's a fantastic field. It's rewarding, and you do good work. And but also, too, I would like to thank the nurses who stayed in Mississippi. Take care of Mississippi folks. You took care of your family. You took care of your neighbors, and that's important. So I just want to say thanks to everybody who stayed to take care of folks.
I would just point out that there is a relatively new $28 million School of Nursing on the campus of the University of Southern Mississippi. I was there when they cut the ribbon. This has been 4 or 5 years ago now. But one of the things that we have noticed in our state and known in our state for a number of years is, and this is pre-COVID, is that careers in the healthcare space are very good careers, and the demand and the need for more doctors, more nurses, more nurse practitioners, more people in the healthcare space is going to just increase as the average age of the population increases, which we know is happening right now. And so, of course, we have a new medical school on the campus of the University Medical Center. When I first was elected lieutenant governor 8 years ago, we basically had a cap of approximately 100 new medical school students per year. Now that's at 150, and so again, we need to continue to look for ways to grow, COVID or not COVID, to grow our number of healthcare workers in Mississippi, because they're good careers, and they're good from a financial standpoint, but they're also very rewarding from a personal standpoint. And I know because my mom just retired as one. So,
Governor, this being an election year, your executive order regarding masking and all social distancing is important. However, this weekend, there's been a big push to have this flotilla, as it were, at the Ross Barnett Reservoir on behalf of President Donald Trump in support. Do you have any fear, or do you have a message to the people there to continue to mask up? As evidenced at the Southern Miss football game, which I attended and photographed, you had a lot of people that did not mask up. Social distancing was established early, but as the game wore on, they tended to get closer and closer to one another. On a boat, you don't have a whole lot of territory to move around. And it's very easy to put 5, 6, 7, 8 people on a boat that really should only have 2 or 3. Any fears, any messages to the people?
well, the one thing a couple of things I would say is that I have been invited to attend the celebration of the president and his re-election efforts, and I'm trying to make every effort to get there. I'm not sure if I'm going to be able to or not, but I certainly support the re-election. What I would say to those who are participating is we have executive orders in place with respect to outdoor venues and with respect to boats, and so I think you can certainly do an event such as that and do it in a safe way. Obviously, maintaining social distancing is important. Keeping a lower number of people on the boats is certainly helpful and advantageous. We've got guidelines in place to do that. But I will tell you, I think that the most important thing for all Mississippians to do, and my message to all Mississippians, is to recognize that this virus is real, it is deadly, and let's just be smart and let's make good decisions and minimize and mitigate the risk associated with everything that we do, and we can continue to drive down the numbers.
Dr. Dobbs, any?
Oh, well, just, these things are not political things, right? So, Republicans get coronavirus, Democrats get coronavirus, Green Party people get coronavirus. So, please, wear a mask, and if you want to go in a flotilla and support Trump, wear a Trump mask. I'll be happy to see that too. So, protect your family, protect your friends.
Yeah, this is a question I was having with some coworkers of mine. When it comes to the CARES Act funds, anything that's not spent is likely going to be sent to the, or at least some conversations I've had, that sounds like it's going to be sent to the unemployment trust fund. Right. Would that be considered going into federal losses that is not allowed, or is that different?
No, I think that would be different. We have an unemployment trust fund in Mississippi, and I appreciate you asking that question because I think it's really important. We have an unemployment trust fund in our state. Pre-COVID, Mississippi had one of the 5 healthiest balances per capita of any state in the nation. And because of that, we've been able to pass legislation over the last 3 or 4 years which provided revenue streams so that we could improve workforce development and workforce training. That's something that we as a state should be exceptionally proud of because we worked closely in the legislature and the private sector to get those revenue streams in place. Obviously, with COVID and the large number of new individuals who were unemployed in March and April, it's put stress on that particular trust fund. The reason I mention that is because that trust fund is not funded through general tax dollars. There is a actual tax that goes and is paid by small business owners that goes into that trust fund to fund it. And the fact is, if we allow that very healthy balance that we had beginning in 2020 to be reduced significantly, then under existing statute, by definition, taxes on small businesses are going to go up in the future to replenish that fund. For that reason, Ms. Jackie Turner, the head of the Department of Employment Security, asked the Mississippi legislature for an additional $500 million in CARES Act monies to help replenish that fund so that we can keep taxes low on small business owners, because we certainly believe that the worst thing that could happen in these challenging economic times around the globe would be for small businesses to have to write bigger checks to the government. The legislature gave the trust fund $181 million. We asked for 500. They got 181. So that's about a $320 million gap. But they did pass legislation, and I appreciate them, which says that any monies that are left over in each of these various programs that have been funded would then be replenished back into the trust fund. That was a good decision, and we need to make sure that we get additional monies back into the trust fund.
So those CARES Act funds wouldn't be sent back to the government at the end of December?
No, that money is going to go back into the trust fund, not back to the federal government. Unless Congress acts and changes things and changes the guidelines, which my gut is that doesn't look very favorable right now. I know that the U.S. Senate was voting today on a smaller package that the Democrats didn't appear to like very much, which I don't understand, by the way, because if you really want to help the American people and one side wants $1 trillion in spending, one side wants $3.5 trillion in spending, but there's $400 or $500 million that both sides wants, it seems to me that the best thing to do to help the American people is to pass that $400 or $500 billion bill so that everyone agrees on, get that out of the way, and then they can start negotiating next. Unfortunately, again, everything has to be political in Washington, D.C., and the Democrats don't want President Trump to get what they perceive to be a win. All I care about right now is let's just help the American people. Let's just help the people in Mississippi get recovered, and we'll worry about the politics later. Yes.
And then, Coach for Dr. Dobbs. Last Friday, you were with the health department on their live stream, and the Mississippi Medical Association on that live stream, and you kind of talked about like we're seeing more deaths this year than were anticipated. Could you talk a little bit more about that and explain that?
That's been sort of one of those denialist sort of mantras, is that there's the same number of deaths as there were last year. It's just we're calling them COVID, right? That's kind of one of the myths out there, and that's nothing can be further from the truth. As a matter of fact, when we look at how many more deaths we've had this year compared to the average of the last 3 years, it's over 3,000 higher, and we've recorded, not quite 3,000 deaths from COVID. We have a pretty conservative mechanism for counting COVID deaths because we want to be as precise as possible, and so we're almost certainly undercounting. But people are dying from COVID. There's just no doubt about it. And we will be releasing detailed graphs and data on our trends that we have so far from Vital Statistics. Expect that to be on our website within the next few days.
There's a lot of stuff going on that's even not considered COVID right now that could be happening.
Well,
related to COVID.
Like we talked about, like on our death certificate, like if you had heart failure and then it had, diabetes and then it had contributing COVID, if it didn't reach the hierarchy of it, we wouldn't count as a COVID death, even if COVID, led to the cascade of death. So, but almost certainly the numbers that we see are somewhat of an undercount.
Well, it's almost 3:30. We're not quite there yet, but we don't appear to have any further questions at this time. I want to thank the people of our state for your efforts. They are making a difference. Please continue. Please stay in the fight. Please continue to do the little things so that in the long term we can all do the big things. Thank you all very much. Appreciate it.